Good afternoon and welcome to another episode of Saving Lives. Today we are here with who I am proud to call my cousin, the illustrious Felicia Williams. How you doing, Felicia?
I'm doing great.
That's good. So introduce yourself to the viewers, Felicia.
So as you said, my name is Felicia Williams. I am a doctorate level nurse practitioner in medical oncology.
Wow. So let's get started with the interview. The first question I was going to ask you is dealing with the time that it took in your education. So over the course of your education career, how many degrees and how long did it take you to get those degrees?
Okay, so I have 3 major degrees. I started out with the Bachelor's of Science in Nursing. That took me about 4 years. I received that from Tuskegee University, and then I worked as a nurse in the hospital for about 6 years before going back to school to get my master's at Georgia State University. It took me about 2.5 years to get my master's. At that time, I also did become certified as a nurse practitioner. And then about 5 years after that, I enrolled back into school at Medical College of Georgia and got my doctorate in nursing. And that took me for about 2.5 years as well.
Okay. So what about the total time it took you to get those?
About 10 years total now that I'm thinking
wow,
back.
I think I could have did that. So, have any of your degrees affected the way you chose your career choice?
Definitely. You know, as a nurse, you learn how to do basically patient care. You learn how to do IVs and work different machines for the patients and everything. And then moving into becoming like a nurse practitioner, you actually start to diagnose and prescribe medication.
Okay. And so, you said you're a doctor of oncology, right?
So I have a doctorate degree in nursing, but I am a doctorate level nurse practitioner.
Nurse practitioner.
Mm-hmm.
So, as being a nurse and nurse practitioner, what are some of the things you do to change people's lives on a day-to-day basis?
So I work in the medical oncology specialty. So my clinic, we treat patients who have cancer with chemotherapy.
Mm-hmm.
And so in clinic, I assess, diagnose, and do care planning or treatment planning for those patients.
Oh. Mm-hmm. And my final question to you, Lisa, are you a proponent for others climbing the career ladder and advancing their education in their career choice?
Definitely. It just opens so many doors. The more education you have, but education still shouldn't limit you and what you do every day, because I know some nurses who have not went to school as long as I did but are great and excellent nurses, for example, like your mom. And so it's all about, you know, caring about people and understanding and listening to people, and also just kind of being there to not just do what patients need to be done to feel better, but also just to have a listening ear as well.
Okay. Thank you so much, Lisa, for coming out and being on the show. What is your name? State it and spell it, please.
Annie Hill, Anniehil.
For whom do you work, and what is it that you do in the healthcare field?
I work for Emory Healthcare in Atlanta, and I'm a registered nurse.
What are your credentials?
I have an associate degree in nursing, and I also have a bachelor's degree in nursing. And right now, I work as a unit charge nurse.
How have you seen yourself grow in your field?
I have grown because, again, I worked as an associate degree nurse for 37 years. I recently, 2 years ago, went back to school and obtained my bachelor's degree in nursing. And I have advanced from a clinical nurse, which is a level 1 nurse, to a unit charge nurse and a
How have you seen yourself grow in your field?
When I first started, I was scared. Every little thing that came through the door, I was scared. Scared to touch it, scared to do anything. Now, anything that comes through the door, I'm ready. I'm rushing to the room, ready to save lives.
How have you seen advances made in your field?
We have a Marcus Trauma Center, which has been renovated. Fabulous. It's larger. We can see more patients in that area now. Our different zones that we see patients in